Well, we are facing a triple health threat over the winter months. Respiratory infections are on the rise with the flu, RSV, and COVID-19 starting to spread. CBS 2's Tina Patel is live outside of California Hospital in downtown LA with a look at the risks and how we should be protecting ourselves. And Tina, now we're hearing of yet another concern.
Yeah, doctors say there is another virus they're starting to see, and that's why they say every day they are looking at their resources, seeing if they can handle all the new cases that are coming in, and they are worried with the Thanksgiving holiday just a week away.
We are at high capacity right now.
Dr. Diana Neves says hospitals across Southern California are already seeing the rise in respiratory viruses they normally see later in the season.
We have every single doctor that's available working, nurses, everybody, so we maximize our staff to accommodate this.
Dr. Neves says not only is she seeing patients with COVID and influenza, she's also seeing RSV in kids and adults, which is not usually the case. And now there's another respiratory virus that is less common.
It's called HMPV. It's a metapneumovirus. It doesn't really matter what it's called, but the bottom line is that it is something that affects you like flu, like RSV. It's actually a variant of RSV.
Dr. Neves says none of these viruses are new. Our bodies are just reacting to them differently because we weren't exposed to as many viruses when we were masking and social distancing during the pandemic. She says most people who get sick can just stay home and they'll recover in a few days. But she says patients should see a doctor if they get severe symptoms.
The main ones are always really high fever that lasts over 5 days. And number one, and number two, significant shortness of breath.
Of course, preventing the spread of viruses is the best way to stay out of the hospital. Dr. Neves says it's not realistic to ask people to stay home for Thanksgiving, but she says they should take precautions, especially when traveling.
If you're on the airplane, you should probably wear a mask out of complete caution because you're so clumped together. I think this season, because of what's going on and because we've been away from viruses, we should just be more cautious.
That means washing your hands frequently, staying away from people coughing and sneezing. And if you can get a flu shot, get a COVID booster shot, doctors say it's those levels of protection that will really help. We'll send it back to you.
Tina, great reminders. We appreciate it. Well, election